another record of 85,000 tests, which means in the last 2 days alone, we've had around 170,000 people get tested. As a result, unfortunately, case numbers have gone up again, 124 cases of community transmission, and unfortunately, 48 of those were infectious in the community. Now, given that number of infectious in the community, I'm expecting case numbers to go up even higher. It's really, really important to continue those high rates of testing because, as Dr. Chant said earlier this week and towards the end of last week, it's really important for us to scoop up all the possible cases that are out there. And we're also finding cases when we're testing workers during that 3 days of required testing. So it's extremely positive that 85,000 people have come forward to get tested. It's a new record in New South Wales. But regrettably, what that has done is uncover more positive results and uncover a very high rate of results, at least 48 who are infectious during that time in the community. There's no doubt again that we anticipate case numbers will continue to go up before they start coming down, and we need to brace ourselves for that. And as Dr. McAnulty will report today, it does mean more presentations to hospital. I also want to say that unfortunately our fears of having spillover from the Fairfield local government area and all the suburbs in that local government area into the Canterbury Bankstown local government area and into the Cumberland local government area have proven to be materialising or proven to be occurring. So we're asking for people in those communities to be alert and come forward for testing, and Dr. McAnulty will read out the suburbs in particular where we do want people to come forward and get tested. Unfortunately, we're finding the two main areas of transmission again, or the two main places where people are getting the virus or spreading the virus, continue to be in workplaces and also in households. Unfortunately, when our health experts are interviewing families within households, we're learning that they have visited families in other households and the disease is spreading through that way. But unfortunately also in workplaces. We're finding that when people are going to buy their groceries or when people are going to the pharmacist or other critical retail or other critical workplaces, that unfortunately the disease is spreading. And recent cases have demonstrated it's not just between workers, which it was before, but we're also noticing now workers and patrons are picking up the disease, taking it home to their families. And unfortunately, if your household chooses to visit another household, which you shouldn't be doing, that virus is then spreading to the additional household. And I can't stress enough how distressing it is for us when we uncover entire families who've got the virus, who've unknowingly or unwittingly given it to their extended family members, households on households of loved ones, just from one worker or one person bringing it home to the rest of their families. The strongest message we can give everybody at this time is please stay at home. Please only leave your home when you absolutely have to. We can't stress that enough. And we can't stress enough how contagious, it's cruel the way this virus is contagious. Any human contact means you can pick up the virus or give the virus. It is spreading like we've never seen before. And I especially want to thank our contact tracers, because if it was not for their efforts, the 124 case numbers today would literally have been in their thousands, and I don't say that lightly. I really want to thank the contact tracing team who've been working 24/7 unbelievably, and sometimes they've had to go back and re-interview people. People remember things subsequently, so please watch out for all those venues of concern. Sometimes close contacts tell us a few days after they've been notified that they remember being in a particular place. So please know those venues of concern are often updated and for good cause. I just want to thank in particular today our frontline health workers, our contact tracers, who've done an unbelievable job, because their efforts have meant that we have, whilst the case numbers are very concerning, they're nowhere near what they would have been, and that should give us heart. But what needs to give us more heart is seeing a change in those number of people infectious in the community. Please just don't take the risk. We're seeing more and more people without symptoms carry the virus and spread it, and we just can't have that continue. So thank you to everybody who's come forward and got tested. That is very positive, and I want to encourage that, obviously, whilst we're in this very dangerous period. But I also say to everybody, please do not assume that anybody you are in contact with, you should assume, I should say, that anybody you're in contact with has the virus or anybody you're in contact with can get the virus. And please know, the last thing we want for anybody is hearing those sad stories of people taking it home and passing it on to the people they love the most. Again, I want to thank everybody for their efforts. And finally, my message for today, as Dr. McAnulty will reinforce, please get vaccinated. The vaccine is key to our freedom. The more people we have vaccinated, the quicker we can live life as freely as we would like. Please know that if you're over 60, obviously, AstraZeneca is available. If you're over 40, New South Wales Health can provide you with AstraZeneca. But even if you're under 40 and you really want to get the vaccine, please ask your GP. Your GP may give you the green light, and people of any age can get the vaccine. Please come forward and get vaccinated. It's so important. It's critical for us to have as much of our population vaccinated as quickly as we can. And the other one bit of positive news is, as I understand it, there is nobody currently in intensive care who's had 2 doses of the vaccine. So we know the vaccine prevents serious illness. There is currently nobody in intensive care who's had both doses of the vaccine of any age, and that is extremely encouraging. It means the vaccine is working in preventing serious illness, and we really need people to remember that and to feel confident when they're getting vaccinated. I'll now ask Dr. McAnulty to provide his update, and then of course we'll take any questions. Thank you.
Thank you, Premier, and good morning, everyone. I'll provide an update of the numbers. So we recorded 124 locally acquired cases in New South Wales to 8 o'clock last night. 67 of the locally acquired cases are linked to known cases or clusters. There were no new overseas acquired cases yesterday. There have been now 1,648 locally acquired cases linked to this outbreak since 16th of June, when this began. 85,185 tests were done yesterday, which is an increase and a record number, which is fantastic to see the community coming forward for testing. It's just so important that people come forward in testing so we can uncover cases quickly. And we're particularly concerned about certain parts of Sydney, as you know, and parts of the country. So I'm going to give you the areas where we're particularly concerned that people come forward for testing if they have even the mildest of symptoms. This is Cumberland, LGA, including Merrylands and Guildford, Toongabbie, Seven Hills, Pendle Hill, Mount Druitt and Rooty Hill, Wollongong, Fairfield, LGA, Liverpool and Bankstown, Lakemba, Narwee, Campsie and Earlwood, Georges River, Bayside, Sutherland, Haymarket, and Orange and Coffs Harbour in the country. In terms of hospitalisation, there are currently 118 people in hospital, with 28 in intensive care, 14 with whom are ventilated. Of the 42 people admitted to hospital at the moment who are under the age of 55, and of those 15 are under the age of 35. So this is a serious disease for people of all ages, and importantly, you can spread it even if you don't have a serious disease. You're easily spreading it to other people who may be very vulnerable and have serious disease themselves. Just wanted to report some outbreaks. There's been an outbreak at the aged care, at the Palm, two aged care facilities, the Palm Residential Aged Care Facility in Kirrawee, where we've tested a staff member who's tested positive. This person wasn't vaccinated, and the residents and staff are being tested. 2 staff members at the Japara Karimbia in Belrose Aged Care Facility have tested positive. Again, we are testing other staff and residents at that facility. There are 5 people at the Unison Disability Parklee group home who've tested positive, including 3 residents and 2 staff members. Public Health Unit has been investigating and making sure the other people are tested and isolated and cared for. In terms of LGAs, the 124 cases reported yesterday by LGA, the breakdown is Fairfield with 30, Cumberland with 23, Canterbury Bankstown with 21, Blacktown with 12, Liverpool with 11, and Georges River with 7. Thanks very much.
Dr. McAnulty, can you just provide an update? Dr. McAnulty, sorry, could I just get the vaccine status quickly, if you have them, of the aged care facilities and the residents and staff that tested positive at the disability care? Do you have a vaccination status for that?
Yeah, so I understand that the workers at the aged care facilities were not vaccinated, but the workers at and the residents at the disability home had received 1 dose of vaccine.
Premier, there's been delays of up to 5 days of people waiting to get their test results. We now hear that New South Wales health officials are taking more than a week to find exposure venues. You keep saying that we haven't lost control of this outbreak. How can you continue to say that when all evidence, the case numbers, infections in the community, delays, all point to the fact that you have lost control of this outbreak?
As Dr Chant reported a few days ago, and I'll ask Dr McAnulty to repeat that, on average it's taking around 28 hours for people to get test results, and sometimes people are getting their test results sooner than that point in time. There was an issue with one private lab, I understand, which Dr Chant reported have since been managed, but I will ask Dr McAnulty to talk about that. He's well connected, not just in relation to the pathology labs and the testing, but also in our ability to get those venues of concern. But as I said, sometimes we need to go back because people might forget or not provide information at the time, and that's why we ask everybody to be alert to those venues of concern. It's not because our contact tracers don't necessarily get to them quickly, it's because people remember things subsequently, or else people may not have known they were infectious at a particular point in time. But given the importance of the question, I will ask Dr McAnulty to provide a health perspective on what you've asked.
Thanks, Premier. So in terms of turnaround time, we have been working very closely with all the laboratories, public and private, to ensure that we've got maximised resources there to get test results as soon as possible. Positive results are fast-tracked, so we hear about the positive results much more quickly. Now, that's very important in terms of us being able to then contact trace. In terms of people remembering the venues they've been to, it does take a few interviews sometimes. If you get, we have a number of tools we use. We have expert contact tracers and epidemiologists to take people through their diaries, through their phone records and other measures to help them remember. But if you can imagine where you've been in the last 14 days, may be difficult to remember, particularly pre-lockdown. So we work with people. They do take time to get that information, and they do remember information afterwards.
Dr. McAnulty, because I mean, there's so many exposure sites, there's so many delays. Are contact tracers now, have they lost it?
No, the contact tracers are doing a fantastic job. We've surged. Every time we have a surge in cases, we surge our staff. We've got people on call who come in, throughout the day. We keep very close tab on that workload. We've got, throughout this pandemic, we've improved our systems for getting on top of the numbers and the cases and making those phone calls and text messages.
On contact tracing, is there a metric that you're measuring how successful our contact tracers, in terms of how quickly they get to cases or identifying people? Is there a measure?
So I might get Dr McAnulty to answer that question, but again, can I take this opportunity to thank our contact tracing team? They have been phenomenal. I have the opportunity to get daily, sometimes hourly reports on how quickly they're getting to cases. But please know that we rely on people to remember everything and to make sure that they're giving us the right information at the right time. And we're deeply, deeply grateful that people generally are doing that, sometimes after hours of conversations. But I will ask Dr McAnulty to explain, given he has an intricate understanding and working knowledge of that.
Thanks, Premier. Yes, our contact tracing team keeps a number of produces regular reports to us. We have regular briefings throughout the day to make sure that we're prioritising those most at-risk venues and close contacts who need to be contacted, and we use that data to make sure that we're surging appropriately. So it's a lot of people that we're having who are contacts at the moment and who are in isolation, and we make sure that they're all followed up as well to make sure they understand and they have their welfare is looked after as well.
Premier, Dr. McAnulty, just into Dr. McAnulty. Premier, just
given the increasing number of people still infectious in the community, where do we go from here? Are you considering greater restrictions that could be imposed, and if so, what would they be?
Well, it's very important to note, unfortunately, those that are infectious in the community are in the main derived from critical activity, buying groceries, going to the pharmacist, having to undertake critical work. We're finding the transmission in those areas where people have to be where they're at, and that's why it's really, really important to make sure that if you've been asked to have a test every 3 days, you do so. If you have the mildest of symptoms, do not turn up to work. Unfortunately, we do get recurring cases of people who have symptoms and are turning up to work thinking they're not infectious. And of course, then we have, unfortunately, people who don't think they've got any symptoms and they're visiting people outside of their household and spreading it. So the messages are the same. We just need everybody to please stick to the rules that we've provided. We do want to see that infectious rate go down. We still haven't completely, obviously not even completely, but we still haven't had the results of what those harsher lockdown restrictions may have had, and that won't happen until the weekend and early next week. But we just need everybody to appreciate how I think people are quite shocked as to how different and contagious the Delta strain is. It's like nothing we've seen before. It is affecting and impacting people in many different ways. It's concerning that over 55% of people that have this virus strain are under the age of 55. So this is a very, very different and more contagious strain than ever we've seen. And it is a concern that infectious rate in the community continues to be high. That's why when we repeat the message every day, and I'm sure people are starting to get weary of it, but don't leave home unless you have to. Don't have interaction with anybody outside your immediate household, like the people you live with, unless you absolutely have to. That's how contagious the virus is. And coming into contact with others, even when you're going shopping to buy essential things or important things, don't stop and have conversations. Don't get distracted. Just be very purposeful every time you leave the house. And that's why we're making sure in workplaces that all those safety arrangements are in place, because this disease is so contagious. And when you have literally in any industry, thousands of people moving around, that means potentially thousands of cases of transmission every day. That's what we're dealing with, and that's why we really need your help. All of us have to work together. We need the help of every single person in the community. And I know that, what gives me heart is that the vast majority of our people want to do the right thing, but I don't think everybody understands how contagious this strain is and how different it is from past strains. So please know that for 18 months we did extremely well in holding back the virus. But Delta is very different to what we have, and that's why everybody needs to treat it differently. Don't go about your business as you may have done during other occasions when we had outbreaks. This is a very different strain, very different set of circumstances, and that's why we need to respond to it differently.
It seems that our contact tracers are lagging behind, listing some exposure sites at least a week late. I mean, what can we do to combat this challenge? And have you thought about potentially enlisting help from other states in trying to combat this, particularly from a resource perspective?
With all due respect, Dr. McAnulty has answered that question, as have I, to say that's not the case. The challenge we have is getting reliable information from people who may not be able to tell us everything on the first go, remember things subsequently. So please know that our contact tracers are well-resourced. They're doing an unbelievable job, and we're very grateful to some states who've offered support, which we've taken up. But in the main, our New South Wales contact tracers are doing an absolutely great job, but we do rely on people who test positive and their close contacts to tell us everything they know. And we are also looking at other opportunities. For example, Health were updating me, and if Dr. McAnulty wants to interrupt and say anything additional, but Health were telling me that now when they get a positive case, they're recommending that person text everybody in their phone, irrespective of whether they've had contact with them in the last few days, just to alert them quickly to say someone you know has tested positive. If you've been in touch with them for a particular period of time, go and get tested. So Health is looking every day at innovative ways to do things to increase the turnaround. But please know that the health experts do rely on people giving us as much information as they remember, as much information as they have. So the challenge for us is really working with communities, working with people who, under very stressful circumstances, are trying to remember every single thing they did for the last 14 days.
I think it was Dr. Sutton down in Victoria that mentioned it, but basically that no jurisdiction has managed to, once Delta has got a run on, has managed to actually eradicate it. Do you believe that we can do this at this point?
Oh, look, there's no doubt that Delta has beaten every single jurisdiction in the world, but that's why we've always said in New South Wales that we want to get close to zero in terms of the numbers of people infectious in the community. We appreciate that cases are going to keep popping up during Delta, but the challenge for us is to live as safely and as freely as we can until we get those vaccination rates up. So we will have some level of restriction in the community. Obviously, we don't want it to be as severe as what we have now until a certain population is vaccinated, and that is the reality that the whole world is facing. Delta strain is so contagious that to be able to live with it, you have to get those number of infectious in the community as close to zero as possible. Otherwise, you cannot live as safely and as freely as you like, and that's why we've been consistently in New South Wales providing that information, and that 48 number can go up. There are always numbers of cases, a handful of cases overnight that are still being investigated. So I always like to say at least that number. It could be higher. And that is the challenge we have. That's what we need to decrease. If people are getting cases, if people are getting the virus when they're in isolation, it's obviously much less of a stress than if they're out active in the community, and that's the number we're looking at. So we're not suggesting our case numbers have to be zero, but certainly we need to have the number infectious in the community as close to zero as possible, because then that gives us confidence that there aren't any unknown chains of transmission, there aren't any unknown pockets of cases we may not have picked up. But I do want to stress that until we have enough of our population fully vaccinated, we will be living with some level of restriction. And that level of restriction will depend on how quickly we can overcome the severity of the current outbreak. You know, I'm looking forward to the day when I can with confidence tell you that we're now on the decline, but we're not there yet. In fact, I suspect case numbers will get worse before they get better.
The results, you still don't know the impact of the measures that you brought in on Saturday and Sunday. You expect cases to rise over the coming days. There's no way that we can get out of this on next Friday, can we? Can you confirm that there's no way that we will get out of this on Friday? And what will you do if the Saturday restrictions don't work?
Well, obviously, what we've said is that there will be still, of course, a level of restriction on July 31, but the extent of that we can't convey to the community until we have more information, until closer to that date. So we'll be able to tell the community this time next week or thereabouts what July 31 looks like. And we'll rely on the information we have up until that time to make those announcements. But please know, as I've said, that we'll be living with some level of restriction. Obviously, we want that to be far less than what we have today until the vast majority of our population is vaccinated. And that's why, whether it's the health experts or whether it's ourselves, we just urge everybody to get vaccinated. It's really important. Please make sure you don't have symptoms or you're not a close contact, obviously, when you're leaving the house. But otherwise, we're really encouraging people to get vaccinated, and we're really encouraging people to get advice from their GP if they're under 40 in relation to the AstraZeneca vaccine. If you're under 40 and you want the AstraZeneca, please check with your GP. If your GP gives you the green light, please get the vaccine. That's why we've engaged all pharmacies as well to support us in getting out the AstraZeneca. Obviously, the GP network is there. Through New South Wales Health, anyone over 40 can get the AstraZeneca. And the reason why at the moment we don't have people under 40 getting AstraZeneca at our own health hubs is because it takes more time to go through all the consent forms, and we're really keen to get as many jabs in arms as possible. So our strategy is, when a longer conversation is required, your GP is the best person to do that, or even a pharmacist. But at this stage, if you're under 40, our best advice is go to your GP to have that conversation. But if you're over 40, you can obviously go to a GP, go to a pharmacist, go to your New South Wales Health site to get the AstraZeneca, and we're really urging people to consider that. As we do have doses of AstraZeneca, we don't have the Pfizer. Clinton hasn't asked a question, sorry.
On the 48 figure, you mentioned that many
I didn't hear the first bit of the question.
On the 48 figure, you mentioned that many of today's 48 are from essential settings. Given that's the case, when do you get to the point, or will you review the target of zero or close to zero?
Well, look, that is always under review, but that is the strong information of our health experts. We have to find the right balance of settings because we don't want to be in a situation where we're going into lockdown, out of lockdown, into lockdown, out of lockdown. I think that's the last thing anybody wants because it doesn't provide certainty. What we want to get to is a healthy position where we can manage the cases, we can manage the rate of infection in the community and have our population live as safely and as freely as possible. We're nowhere near there yet, but clearly from July 31, we hope to be able to explain to the community what we can do in relation to adjusting those settings, and that's what's really important. But our real key to freedom is having a high percentage of vaccination, both doses, but even one dose gives you great protection. So if you haven't had any doses of the vaccine, even a first dose gives you a lot of protection. And as we've seen, one of the green shoots is that both doses of the vaccine are a huge protection against serious illness, and that's what we need in the future. I think if people appreciate what the New South Wales government has been saying for a long time, is when we have a large proportion of our population vaccinated, we won't be talking about case numbers anymore. That will be less relevant. We'll be talking about the people who have serious illness in hospital, because what the vaccine does is prevent serious illness. Unfortunately, because a lot of our population doesn't have any dose of the vaccine, it means that people who are vaccinated can still pass it on to others who may not be vaccinated. And that is the concern. But once the majority of our population has both doses, or at least one dose, it does give us more freedom to relax even more settings. But obviously, we'll have more to say about that this time next week when we pick up the data on what the additional harsher restrictions have had on our community and on those infectious numbers.
Premier, can I just circle back?
People still doing the wrong thing. You said it yourself, visiting households, not being forthcoming with their information about what they've been up to. We're almost 4 weeks into this. What more can you do to target them specifically and not punish the rest of the community that is doing the right thing?
No, certainly. And can I say the vast majority of the population of our citizens are doing the right thing. And most people, when they ring Service New South Wales, are actually worried about getting in trouble. So they're ringing to say or to ask, what can I do to avoid getting in trouble? So we know that the vast majority of people are doing the right thing. And I want to say to our citizens, you're not going to get in trouble if you're trying to do the right thing. But those handful of people who knowingly are doing the wrong thing are not only compromising their own safety and well-being, but those of others. And can I say that both the Minister for Health and police are working very closely? Yeah. Well, can I say that the police and our health officials are working very closely to tighten anything we can to ensure compliance. And we understand the importance of people doing the right thing, but we also understand that we need the right deterrents in place to stop people doing the wrong thing. And it's very, very frustrating when so many are giving up so much. So many people are giving up so much to keep everybody safe. We expect that standard of everybody. And when people are doing the wrong thing, please know you will have the law thrown at you. You will.
You said that case numbers.
I'm sorry?
Yeah, perhaps being able to lift it for people you know who are doing the right things, whether it be construction, schools going back and the like, and then just specifically honing in on those who are doing the wrong thing and making this situation worse.
Well, please know the New South Wales government is working very hard to see what restrictions we can ease from July 31. That will depend very much on the data we get over the weekend and early next week. So we'll be looking very closely at that, but it will be based on the health advice. It will be based on how many infections we have in the community. The last thing we want is to be in a stage where we keep going in and out of harsh lockdown. That's not something we want for our citizens. We want to provide our citizens with certainty, and that's what we'll do next week.
Yesterday you said some low risk.
Oh, Ursula, you haven't asked a question yet.
I have, but
I'll have you. Oh, sorry.
could I ask
sorry,
about Qantas? Qantas is saying that if it extends, that they may need to lay off staff. Are we expecting? I mean, what's your message to Qantas workers? But also, you know, this is going to be a massive impact if we can't get this down.
Oh, look, there's no doubt that many sectors, including aviation, have been doing it tough for the last 18 or 19 months. And that's why, you know, I've been so vocal in relation to state borders in that time, because we know that all of that has resulted in companies literally being on their knees. But I want to stress that in the last few days, I've just been so grateful to Service New South Wales. We've processed thousands and thousands of business applications. Please know that if you're a business that is struggling, the grants are there to be accessed. The grants are there to be accessed through Service New South Wales. And I understand Service New South Wales is also providing information publicly on not just how to access those grants, but also how many we're getting through every day. And we're really grateful for everybody's patience. But to be able to have processed in excess of, I think yesterday was around 16,000, that number might be higher today, applications is positive. But also, please know, for individuals, you can access disaster payments through Service Australia. Those disaster payments have increased. So if you're someone who is struggling, has had reduced hours, you can go through Service Australia. But also more generally, if there's any concerns you have about helping you and your family get through this, please go through Service New South Wales. That is our front door to all of the services our government's providing. If there are any loopholes, we will find them and close them, but we don't want anybody, I mean, everybody's under a lot of stress already as it is. We don't want people to feel that they can't go without the basics, and that's why it's really important to know where you can get help. And we're also working in a very, very targeted way on the ground in local communities, especially in those communities that have been most impacted, to provide direct access and support at a very grassroots community level, and that work is ongoing as well.
You said you could consider easing. Yesterday you said you could consider easing restrictions in low-risk settings. What is a low-risk setting?
Well, obviously, settings. Well, I'll tell you what, the high-risk settings are settings where there's contact with people coming together from different areas. Now, that is, any human contact is a high-risk setting. Any human contact outside of the household at this stage is a high-risk setting. So if there are settings where things can be undertaken with as little contact as possible, with frequent testing, there are considerations the government is making at the moment, and please know that will be based on the best health advice, and we'll make sure that, you know, our aim as a government is to keep our citizens living as safely and as freely as possible until we get the vast majority vaccinated. That is our standard mission. It is to have our population be as safe and as free as possible until we get the majority vaccinated. And what that looks like on July 31, we'll be able to tell you in about a week's time.
It might be one for Minister Hazzard or you, but people are having their vaccination appointments cancelled because their GP is saying you live outside the 10-kilometre radius, therefore you can't come to our practice to get your jab. Is that...
I'll ask Minister Hazzard to answer that question.
Because, yeah, it's pretty obviously vital that we get these jabs in.
Obviously you can go straight for your medical appointments. That's an misunderstanding, I think, by the GPs. So certainly the message is very clearly to GPs. There's always been exemption to leave your home and to go for medical attention. And can I say there's just nothing more important than getting vaccinated at the moment. It's a challenge. We don't have enough Pfizer, but we've got plenty of AstraZeneca. And as the Premier has said, we're awash with AstraZeneca. But because of messaging that's come out, obviously, from both the advisory body and then translated by the federal government over the last few months, it's made people very hesitant to go and take the AstraZeneca. Sorry. So the short answer here is you need to get vaccinated. As the Premier said, if you're over 40, we can do that in our hubs. If you're under 40, you can go and talk to your GP, and I'd encourage everybody, including the media. I was ecstatic to hear that Kyle and Jackie O have been doing their bit. Well, Kyle's done his bit with Get Vaxxed Baby. I love that song. That's fantastic. Anything we can do with the media to get out there and actually support getting vaccinated. There is no other solution other than listen to the requirements that health have asked you to do. The Premier's repeated it time and time again. We've obviously got issues about families still visiting each other and unfortunately the virus being spread when people go to their essential shopping. But there is only one real solution. At the end of the day, it's get vaccinated, or as Kyle says, get vaccinated, baby.
Minister
Sorry.
Hazzard,
yes.
Minister Hazzard, the Premier said that police and health are working to tighten anything that might need tightening to ensure that we have the right settings. Police have expressed some frustration that on the mask rules, requirements to wear a mask do not apply to anyone with a physical or mental health illness or condition, or otherwise, or a disability that makes wearing a fitted face covering unsuitable. Now, there's no provision in the order for police to ask for proof of that condition. Should you change that?
Well, actually, again, the media have been generally, most of the media have been very, very helpful and I want to acknowledge Ray Hadley. Ray Hadley actually texted me at some stage late yesterday when I was dealing with a whole host of other issues that the media were raising, coming out of somebody backgrounding about something or other. And I was unable to address that until early this morning, but I've actually worked with Health and instructed our lawyers to prepare an amendment to the orders, which I was hoping to have signed by 11 o'clock, but didn't get done because there was so much happening this morning. And that is to say that from here on in, if you're outdoor, or if you're required to wear a mask, if you don't wear a mask for what you say is a medical reason, you will be required to have on your body, in your possession, a letter or other evidence from a registered medical practitioner explaining that that is actually a true situation.
And why did it take the media... Sorry, Minister, just to clarify...
Sorry, Danica, could I just finish with...
Yeah, why did it take the media raising this issue for you to fix it?
Because there are a whole host of issues that are being progressively... It's like you expect constantly everything to be perfect. I've said this 100 times. We are in a pandemic, a very serious pandemic. The playbook there was no playbook last year when we were dealing with Alpha and the earlier parts of this virus, and everything had to be done and learnt on the hop, as is evidenced by what happened last year. We're now dealing with effectively a completely new aspect of that virus that operates in its own horrendous way. And so we're still learning, and we are doing what we can, but it's also proportionate responses. Sorry, Ashley. It's always got to be a proportionate response. As the Premier has said, we don't want to impose, as a government, we don't want, and no government wants to, well, perhaps some in other parts of the world, but nobody here in Australia wants to impose restrictions on our population that are absolutely unnecessary or that appear to be unnecessary. So we've got to do it proportionately and sensibly. We take health advice. We're always taking discussions. Every day we have discussions with the police, and we try and strike that balance.
Just on surveillance.
Sorry, Danica.
Can I just clarify, just on surveillance testing for Liverpool, there's been a bit of confusion exactly what is required for surveillance testing in that LGA. Can we get some details on
I think
that?
I should actually ask Dr McAnulty if that's all right for that. Is that all right?
Can we just do one while you're there?
Could I have one quickly on people?
Okay.
For me, you mean? Yeah, sure.
Sorry.
So I'll do... Well, actually, can I take yours, Ursula, and then while
Very
that's being
quickly,
sorted
there's
out...
class action, again, by health workers, etc., who don't want to be mandatorily forced to have the vaccination.
I'm sorry, can you say it again?
There's a class action for people who are being who have been made mandatorily to have the vaccine and they don't want it. Firstly, are you worried that that will be successful and people won't be forced? And we're still seeing issues of health workers unvaccinated, putting people at risk. What can we do here?
Look, I can't comment on the legal action. I just don't know about that at this stage, so I need to look at it. But obviously, again, it's a progression during the response to the pandemic. We've had to step up and tell a number of different health workers, aged care workers, that you have to accept being vaccinated or you can't work in that particular area. And that's continuing. So at this point, that's the response that health has actually taken. Somebody wanted something. Oh, Alex, sorry.
You mentioned it before, but how disproportionate is the take-up in the government clinics and centres of Pfizer compared to AstraZeneca? Is anyone taking AZ?
Let me just give this example. The day before yesterday, there were about 9,000 Pfizer vaccinations given in our Homebush or Olympic site hub, and 50 were taken up by AstraZeneca. And I think that's obviously come off the back of advice that came out of ATAGI and then, or the advisory group, but also then translated by the federal government. I just think we need to take a step back and say, well, right now we are in the middle of a very serious outbreak here in New South Wales, and we can't afford, generally, most of us can't afford the luxury of sitting back and saying, I don't want to have the vaccine that has actually been taken by almost every country in the world and kept other countries safe. So that's why the Premier and I and Dr Chant and Dr McAnulty are all saying, if you're over 40, you can have the AstraZeneca in our hubs, and of course we still recommend you should go to your GP preferably, because GPs should be at the front line of actually giving the vaccines. But if you're under 40, then go and have a chat to your GP, and your GP may well give you good advice, which is take the AstraZeneca. You can imagine if you're sitting somewhere in the middle of a hotspot area, you should take the vaccine.
Sorry, Premier. Just in regards to the case numbers, Premier. Sorry, just in regards to the case numbers, Premier. You said that they would. You said that they would. go down, the number of cases under the more tougher restrictions. But in actual fact, they're going in the opposite direction. They're getting higher. So are you comfortable with the current settings that are in place?
That's not exactly what I said. What I did say is we won't know what impact those harsher restrictions have had until at least the weekend or early next week. So we'll be in a better position then to assess. But what I do know is the fact that we stopped literally tens of thousands, if not hundreds of thousands of people moving around at multiple sites would have resulted us in having far more, or would result in us having literally thousands of cases. So we know when we stop people moving around, when we ask people to stay at home, it does have an impact, because the alternative would have been thousands and thousands of cases. And
Cases are going higher though. They're going in the other direction though. That's the issue.
No, well, exactly, because as I said, the impact of those harsher restrictions won't be felt. The extent of those won't be felt until at least the weekend or early next week. But it doesn't mean we won't have similar numbers potentially. That's up to all of us. What if people start getting more active and more mobile? We don't want them to do that.
So you're comfortable with the settings that are in place at the
moment? That's based on the health advice. That's based on when the health experts tell us there's particular incursions, there are particular settings they're worried about. We respond to those settings, whether it's in the regions or whether it's in Greater Metropolitan Sydney, including Wollongong and Illawarra, or the Central Coast. We respond to the advice that the health experts provide us, and we base it on the best evidence that we have. But sometimes, as you know, we need to wait a period of time before we can assess what impact those settings have had. But what we also know is some restrictions obviously have a greater impact on society with varying degrees of success, and that's the challenge of what we need to assess. We need to assess to what extent can our population be given freedom whilst we are going through these difficult times, and to what extent we need to maintain the settings we have. And
how can the public be confident though? How can the public be confident?
You know, I asked a number of questions ago about Liverpool and clarifying who is actually required to do this.
So at this stage, obviously until recently, Health has sent out recurring messages to both Canterbury Bankstown in relation to health and aged care workers. For Liverpool, I understand that will occur from Friday. So at this stage, as a priority because of the concentration of virus cases, obviously anyone leaving the Fairfield local government area, and I should stress that means all the suburbs within that area, have to go that 3-day testing no matter what category of critical worker they are. In Canterbury Bankstown, it's currently health and aged care workers having to do that every 3 days, and I understand that will be also reiterated for Liverpool from later this week.
And why are people who work in those settings?
You keep talking now about close to zero. For the sake of clarity for everyone watching at home, when you say that, what exactly is close to zero? Is it 5? Is it under 10? And for how long do we need to be at that level before these restrictions are going to ease?
Because that depends very much on the settings and the health advice. If people have been infectious in the community at a location where there wasn't a lot of people around, or it was, would vary differently from someone who may have been exposed at 20 different venues. So it really depends on the health advice we have on those exposure sites. But that's why we need to get that number of infectious in the community as close to zero as possible, because that then allows us to have a degree of confidence that there aren't unchecked chains of transmission. And that's the scary thing about Delta. Often when the cases are linked, that gives you a degree of comfort, even though nothing about this gives you comfort. But
it needs to be for a number of days. It won't just be one day you get 5 cases, bang.
Well, obviously, that will rely on the health advice. But we need to make sure, therefore, that we assess the health advice and also understand the settings that all these cases are infectious in to be able to make those decisions. But that's why we look forward to coming back around this time next week to give the community certainty on what July 31 looks like. But please know that the measure for us, the question we ask ourselves every day, whether it's the health experts or whether it's obviously members of the government, is how can we allow our citizens to be as safe as possible and as free as possible given the existing risk. And I can't underscore what a serious situation we're in at the moment. The fact that we have 48 people who are infectious in the community in the last 24 hours is not a good statistic. It is not a good statistic. That tells us case numbers will continue to go up in the next few days.
The fact that we're going up, though, the fact that we're going up, Premier, just on the case numbers, though, like the fact that we're still going up, it shows that the health advice and the decisions that were made based on that advice were insufficient or they were wrong.
No, I completely reject that. I completely reject that, because what it shows is, had we not taken the action when we did, you just look at any other country on the planet. Absolutely.
Still going up.
No, but if you look at any measure across the world, we have countries or jurisdictions with smaller populations than ours having thousands and thousands of cases every single day. The fact that we have as high as 124 is, and I don't like that number, and that number will likely go up in the next few days. I don't like that number, but the fact that it's not thousands should give us a degree of comfort, because that's what it would have been. And I can't thank enough the health advice, the health experts, and also our contact tracers who've been unbelievable, but the whole health team, all of our frontline workers. And we now have a situation where we desperately need to get the number of infectious in the community down, and we know that's all up to us. We need to make sure we're not moving around unless we absolutely have to leave the house.
And we need to under the current settings, though. That's the issue. So how can you be confident in the health advice that is? How can the public trust this health advice?
But I'm trying to explain that the current settings we have, the impact of those won't be felt at all until. Well, no, but what the previous settings have done are prevent thousands and thousands.
They were brought in to bring cases down.
Well, no, they were brought in to prevent thousands and thousands of people getting the virus, and that's been successful.
Did you want to eliminate the virus 2 weeks ago?
I'm sorry?
The restrictions that you brought in on Saturday, that we will start to see the impact of from Sunday, were they designed to bring cases down, which is your aim, and if they don't, will they have failed?
Well, no, because what you never know is, for example, when you stop tens and tens of thousands of people moving across multiple sites a day, you never know the alternative scenario. We know for a fact that the more mobile our population is, the more people from different suburbs mixing on the same work site is a huge, high risk area of contagion. So we will never know the alternate number. What we do know is that we have prevented thousands and thousands of people getting the virus, especially now when we don't have, unfortunately, the vaccination rates where they should be or need to be. So in that scenario, we have an obligation to our citizens to keep them as safe as possible until we get the vaccination rates up. And of course, we want to provide as much freedom as possible moving forward as well. But that will depend on what the figures look like in the next few days.
Premier. If we get to next Tuesday and the numbers don't change as you're suggesting they might, what are the contingency plans? What is the plan B for people going forward who are wondering what is going to happen if case numbers do not go down?
I never ever want to delve into the hypothetical, because it's important for us to provide as much information as we have to the community. So as I said, we will have a good number or a good idea over the weekend and early next week as to what the numbers look like. But we also have to accept, given the trend, that numbers may continue to keep going up. But what we will never ever have, and this is a fact, what we will never ever have is the alternative scenario. Had we not put in those extra restrictions, thousands and thousands of people may have been exposed to the virus, and that would have been a situation which would have seen us get out of control, which would have seen us not be able to consider any freedoms moving forward. We are still in a position where we can consider freedoms moving forward until our population is vaccinated, and that is the position we want to hold and a position we continue to fight for. And our biggest challenge is reducing the rate of those numbers in the community that are infectious every day. And that is what we need to keep an eye on. We can't have people with the virus, knowingly or unknowingly, walking around, transmitting it to others in their workplace, transmitting it to patrons or clients, or worse, going home and giving it to their closest people. And that is a situation that we need to break the nexus of. And we haven't broken it in the way we need to. And that is why we're appealing to the public, we're appealing to every single person in the community. Please, please accept this is different to what we had in the last strains. That's why we need the response to be different. No matter how careful we were before, we now need to be extra careful.
Minister, the parents of sick children, really sick, leukemia patients, are having to spend 24-hour shifts by their child's bedside because they're not both allowed to be in there at once, and they have to only be there for a full 24 hours, then they get to change over. The other one goes back to Ronald McDonald House. They're in a bubble. Is there anything we can do for the families of really sick children to make sure that they're not by their child's bedside in isolation?
So I say one of the one of the very difficult, I mean, there's so many difficult issues that have arisen as a result of this pandemic. But one of the really difficult issues is that people who, by their nature, are compassionate and caring. That's what our health staff are. That's why they take their work. But they're having to make decisions in advising families in very difficult circumstances, not just in the situation you're talking about, but as we talked about, I think, a couple of days ago, people who are giving birth, palliative care. They're having to make decisions about trying to minimise the possibility of incursion of the virus into our hospitals and to obviously having a terrible effect on not only the individual patients but the broader patients in the hospital. I've certainly talked to health staff, senior staff about this, both in the ministry but also in the broader areas, so in individual hospitals, and they're all agonising over these sorts of decisions. I think that from time to time there will be situations where it does seem it just doesn't seem right, but in the reality, if you look at the bigger picture, what they're trying to do, they're trying to keep that family safe. They're trying to keep that child with leukemia when you have leukemia, you're very, very vulnerable to viruses, bacteria, anything. So they're trying to make sure that they minimise the risk of those little kids to what is the most potent virus we've had probably on Earth. It's a shocker. It's managed to take control of the whole world, and that's only the second time in 100 years. So I'll talk to them again about what you're raising, but I've just got to say we've also got to understand that other aspect.
Minister, you've raised the unwillingness of people to get AstraZeneca. We've still got so much there sitting there waiting to be used. It would seem that the federal government's ad campaign to encourage vaccination perhaps hasn't been all that effective. Is it time for New South Wales to think about rolling out its own ad campaign, particularly to target these hotspot areas, to get people out and to get them to take the AstraZeneca?
Look, again, it's fair to say that we've discussed those issues. And the federal government have made an effort, albeit somewhat belated, to get an advertising campaign out there. I think the federal government are in a bit of a tricky spot because they just haven't got the vaccine that they know that everybody needs. They tried to get it, they haven't got it. And I guess their dilemma has been how far do you go in terms of advertising when there's not the vaccine available? Personally, I think that there's been some discussion about what the nature of those ads are. I'm not an advertising expert, but I do know that we need to have a type of advertising that encourages particularly young people to come forward, and older people, but particularly we're seeing about almost 60%. I mean, going to the question that was asked before by James about effectively the differences between now and last year. Remember last year we were talking about the fact that this virus was affecting older people and targeting them. That was that variation of the virus. Now what we've got is effectively almost a new virus in the sense that I think the current numbers are showing about almost 60% are young people under the age of 35. We've got young people in intensive care. It's a really serious issue for young people as well. And I'm not sure that that message has actually got through to young people yet. So my view is that it would be helpful if the federal government were to look at an advertising campaign that worked across the whole of Australia to encourage people to move forward, not necessarily scare them, but encourage them. And there are a lot of ways they could do that. As I said, I'm not an advertising expert, but I know there's been a lot of people that young people look up to. I look up to. I mean, the Hugh Jackmans of the world, there have been various people offer to assist at various stages. So I think maybe that should be something they do look at. Maybe even Kyle will say, if Kyle can do Get Vax Baby, and I listened to the song this morning, and I tell you what, it was a light in my life this morning.
And thank you, Andrew.
It's a light in my life to think that there is somebody out there from the media who is not only prepared to put the message out there, but get the message to young people about the fact that it's needed. Don't ruin a good. I know Sky's great, but I've got to say, right now, Kiss is doing a lot better job on that.
Can I ask you about
Sarah.
bubbles, please?
Police, please.
Minister, it's an important question.
Sarah.
A question for police, if we may, about the first day of lockdown.
Sorry, I'll take Kiss first. You don't show up very often.
First press conference, you do talk about Kyle Sandlands, someone who is influential when it comes to the Australian product, the public, sorry. Is this an opportunity for, Kyle, we talk to our millions of listeners every morning. Is that a place that we should be going down for the next path? Get the vaccine. Let's use you people like Kyle to get that message out?
He wants to ask a question, sorry.
What was that? Sorry.
Can I just say, as far as I'm concerned, Kyle and Jackie O, particularly Kyle, he put his own time into it. I heard the song this morning. I got to say that was great. And to bring that sense of enthusiasm and energy about going forward, about what we can do to get vaxxed, good on Kyle. I think he did a great job. One question, as last question to the Deputy Commissioner. Because we've got to go and do some work.
Mr. Warbaser, the first day of lockdown in the Central West, can we get your report card in terms of the compliance for the communities out there? We are hearing there was a gym that was fined. Any other issues or generally happy?
Look, I think police and people of the Central West have great community spirit. It's been demonstrated in the last 24 hours how they've received the stay-at-home orders. Overwhelmingly, people are doing the right thing in those towns of Molong, Orange and Blaney and District. There is an emergency management response in place there with local people, with local government, with local health and government and other non-government agencies to support people in what will be a challenging time for them. But overwhelmingly, that area of the Central West has responded well. They need to make sure that they take notice of the orders. There are additional police in place. They are there to support the community at a time of need. And I have no doubt if people follow the orders and do what's asked of them, it's a stay-at-home order, that they will get through the next 7 days fine.
Minister Hazard,
Minister Hazard, can I ask you please about Sybil's bubbles? But are you going to make an announcement soon, Minister?
Where's Dr. Sharp, Minister?
Thank you.